adjust.
Oh, look at that fire.
Look at that fire.
That looks awesome.
Look at that fire. You guys.
Hi.
We're here a little early just to let people kind of congregate, join us here by the hearth. Yeah, get it, Lucky. Yeah, people are starting to show up now.
That's so
It's
cool.
still early. Yeah, so I'm here in Jersey because why not? That's just how it works.
It's a good night.
It is a
We're
good
having
night.
a good night.
It's a good night.
It's a perfect night. It's that October air
Yeah.
and the fire.
Yeah.
It feels like Halloween.
Yeah, it's great. It's fall. Hello. How's everyone? Oh yeah, here we go. People are coming. So yeah, this is. We'll really start this whole shenanigan in like a minute or so, letting people show up. So yeah, it's what is this, Tuesday?
It's Tuesday night.
I'm still so messed up
It's
from my
October
travel.
27th, and I know that because it's my mother's birthday tonight.
Oh, that's very
Happy
good.
birthday, Mom. Yeah.
Yeah.
Today's her birthday.
Look at that. Yeah, we have a roaring fireplace back there. We're very excited. Her husband Joe is out there chopping wood like a lumberjack. And we're just getting it done. So yeah, what time is it?
It is 9 o'clock exactly.
Okay, we'll still give it a little bit before we kick into it. You still haven't received your box. That's because they are still shipping. Okay, you will get your box. I promise. So yeah, I'm here in Jersey. So for this entire year, we're very cozy. We've partnered with Evenflo to be able to do this Facebook Q&A session. We do it once a month about breastfeeding and pumping. And usually it's like chat on Facebook, question and answer with videos that Shari has made that we just kind of embed and use as answers. But here's some backstory here. 5 years ago, I met this lady online. She used to do this web series called My Baby Experts. And that's how I found her, where she would have like Q&As with experts and whatnot. So I used to go to her old store in Jersey, and we used to do live streaming video before any of this wacky technology was there.
Wouldn't it have been great and easy back then?
This makes it a lot easier. It used to be like 2 cameras and 3 computers and sound stuff, and it was a hot mess.
Yeah.
But it was great because forward thinking. It was a way to be engaging with an audience immediately and answer questions. And I used to go out there all the time to do it. So y'all know me, whatever. So I'm just going to let Shari kind of give a little intro about her background, what she does, what she did, and how she kind of fell into this world. So, hi.
Hi, Jamie. Well, yeah, it's actually really awesome to be doing this because it feels like we've done this a million times.
We did
this a million times. And it's so cool to be back doing it and actually live because it's been a few years for me. But as Jamie said, this was something that I was doing 5 years ago when no one was doing video, and we would do the show, and we would do it every week and have all these great guests. And Jamie was absolutely my favorite person to have because we just had so much fun together. And it was so educational, and it was so much fun. And you would sleep over my house.
We'd have our so delicious coconut ice cream bars. I would drink wine out of this enormous goblet. It was hideous.
A pink plastic goblet.
But it was great. We had a really, really good time.
We had such a good time.
Yeah.
And it's just really great to be. This year's been amazing. I work with Evenflo. I'm actually their spokesperson. I helped them design their new advanced double electric pump, and so Jamie and I have been working together with Evenflo to help moms understand and learn about the new pump, and doing the Q&As every month to teach and answer questions about breastfeeding. And so many of you have been doing that with us.
Your background is what? I feel a lot of people don't know your background.
So I'll tell you a little bit about my background. Let's see. I've been taking care of moms for 25 years now. And I started as a labor and delivery nurse. and I worked in labor and delivery for about 7 years as a nurse, and then I became a certified nurse midwife. I had my own practice. I delivered over 600 babies, and that's what I was doing for the majority of my career. When I had Jade, who's my oldest, she's going to be, oh my God, she's going to be 14. Can you believe it? She's going to be 14 in January. When I first had Jade, there was nowhere to go to get products. I mean, the internet was just starting. You couldn't even really shop online at that point. And, you know, I had this like Babies R Us 45 minutes away and decided to open a store. And had a retail store, became an international board certified lactation consultant, started doing consultations, and started teaching my own classes, which then later were filmed into programs that are actually available, that you can actually watch a breastfeeding class through my website, or they come included.
They come with the Evenflo pump.
So when you buy the pump, both of my breastfeeding courses are included with the pump. And so it's just been an amazing journey over 25 years.
Yeah,
and then we actually started the show in, what, 2009? Like 2008, 2009.
Yeah.
It's like crazy to even believe that was that long ago. But
and how I gauge everything, because I met you when your little Lucky dog over here, y'all had just bought Lucky.
And
so he's 5 now.
He's 5.
So it's been 5 years.
It's been 5 years.
That's insane.
It goes really fast. So that's my background, and this year's been awesome to be able to answer all your questions, and that's what we're going to do tonight too. We got a ton of amazing questions.
So we asked for your questions in advance. So how this is going to work, we have questions that a lot of you submitted. We picked a few of those out. And she's gonna answer those because that's her job. I'm going to read the questions. And then we're gonna open it up to questions live here, okay? So totally engage, interact, but listen and learn, because we're excited to do this live. I took a bus to Jersey.
He did take a bus.
A bus. I rode a bus. Lucky. I need you to calm down over there.
I think he wants to be.
So yes, Lucky.
He wants his time. Yeah, you can bring him here.
Here,
let's introduce Lucky so you can hear.
Just so he can calm down. This is Lucky. I don't even know what kind of dog this is, okay? But you'll notice this sensible diaper apparatus that they have made him. You have basically made a bootleg Grovia.
I did. I really did.
And how did you accomplish this?
So I've never had a male dog in my entire life, so I didn't know that these dogs mark. Okay, he's the cutest, but he pees all over my house, and so the dog has to wear a diaper. So this is actually a reusable cover. It's a cloth cover, just like a cloth diaper. And then what we did was, inside, I put one of those poise pads, you know, those incontinence pads.
Listen.
Stuck it inside the diaper.
Bootleg Grovia for dogs.
And it totally works. It totally works.
You gotta do what you gotta do sometimes. And he's the same size as when I met him 5 years ago. He has not grown.
He's holding on to me.
He's little. All right, little thing. Come on.
You need to go.
All right, so let's get to questions. I have something on my nose. Okay, did you have yours marked over here?
A couple.
Okay.
Let's see.
Who are we going to first?
Well, this one right here.
All right. Jenny Moore asks us. Jenny Moore writes in, and she says, I had my son 8 weeks ago. I started pumping around 4 weeks, several times a day to start building up a stash. I've never been able to get more than an ounce from each 20-minute session. I'm even taking brewer's yeast tablets and fenugreek to up my supply, and it's not helping. What can I do to pump more? Also, my son is getting enough to eat while nursing, so it's just a pumping issue.
You know, it's been amazing to read all these questions, and especially to start off with this one in particular, because there's like, as I was reading through all the questions, I was thinking to myself, here's the good news and here's the bad news. Okay, you ready? The good news is almost all the people here have no problem at all. Yeah. That's really good news. The bad news is they're all worried they do. Yeah. And so that's creating the stress and the anxiety and not knowing how much are they supposed to be making. So this is a perfect example of that. So Jenny, what you're describing is that you're exclusively breastfeeding your baby and your baby's doing great. So your baby's gaining weight, your baby's doing fine, and you're pumping in between those feeding sessions an ounce, which is actually a lot of milk. And it actually comes down to just knowing how much does a breastfed baby even eat, because you're not supposed to be making more than that. An ounce in between feedings is actually a good amount, and I don't recommend pumping more than, say, 1 extra feeding throughout the entire day total, in addition to what you're feeding your baby. So that means if a baby's eating somewhere between 3 and 4 ounces at a feeding, that's how much extra milk I would recommend pumping in addition to what you're feeding. No more than that.
Just
3 to 4 ounces. And if you're doing that, say, an ounce 4 times a day, you're totally doing great. So taking all the extra supplements, trying to increase your milk supply, you really don't want to do that. Babies don't eat that much, and trying to pump and get more out of your breast can actually cause problems like breast infections, plugged ducts. Oversupply can be a bigger issue.
Can you show us the actual model of the we have props.
We have
okay,
props.
We have props.
We have props tonight.
Of what a baby's stomach size-wise actually is.
So this is something I go over in my online course on breastfeeding, and it's really important to get this visual because especially this is like day 1 of your baby's life. This is actually their size of their stomach. And
it's a marble.
I don't know if you can actually see that, but it's super small, okay? And what they eat on day 1 is about 5 cc's. It's like a teaspoon at a time. So when you see that in a bottle, it's like this tiny little amount.
It's nothing.
It's not real. It's colostrum. It's not real milk, and not full milk at that point. This is the size of a baby's stomach on day 3, and it's about 1/2 ounce is what they're eating. This is like when you're about going home, just transitioning from the hospital to home, or your milk coming in. And then this is day 10.
Don't break that egg.
This is day 10, and this is about 1.5 ounces, and that's about what a baby.
Oh, hold it in front of my shirt. That's what they're saying.
Oh, can you see it?
There.
It's small.
So going back,
it's one of those little plastic eggs.
Day 1, marble. It's tiny. It's almost like it's a little bit like a thumbnail, like the top of a thumb.
Yes.
Little bitty.
And this is day 3.
Day 3.
Milk is transitioning. Coming in, 1/2 ounce at a time. And then this is day 10, and that's about 1.5 ounces. That's what your baby's eating, 1 to 2 weeks old.
Great.
Okay? Now, as they continue to get bigger, they're only eating about 3 or 4 ounces per feeding, and it doesn't really increase from that ever. So this is like news to a lot of people, is that they don't.
And what a breastfed baby
It's so different.
ingest is very different than what a formula fed.
So different. And I think that's what causes so much of the confusion is that moms will typically see a formula bottle. So you're used to seeing like these 7 or 8 or 9 ounce bottles of milk, and then you think, I need to be making that much milk, which is not the case at all.
Yeah.
In fact, you actually make less milk the second half of the year than the first. Baby's starting to introduce solids. So, I have this here I wanted to show them.
Okay.
This here is actually a full feeding, and that's 4 ounces of milk.
Here. 4 ounces. Okay.
And that's surprising to a lot of people.
Yeah.
They don't realize that it's not that much.
It's not.
It's not that much. So if you're pumping that, and that's going to answer like 100 questions. I just kidding. If you're pumping that much, you're doing really, really good.
Yeah.
You're doing good. So.
Yeah.
That was a long answer to
But
the question.
you know what? It's
but
needed.
it answered a lot of questions.
Yeah. A lot of these are like, my baby is fine, everything's great, I'm pumping, and I'm only getting 4 ounces. 4 ounces is pretty damn good.
Yeah. Oh yeah. Especially if you're feeding on top of that.
Yeah. And there was another question in here. I mean, while we're here, this lady was like, I've introduced solids at 6 months. My baby doesn't seem to be nursing as much. Is that normal? It is, because they're getting their nutrition elsewhere.
Definitely. As your baby starts to eat solids, they're going to be less hungry, obviously, because they're eating food. So the amount of milk that they start to eat could be less. You want to offer them the breast and then feed them after. But that's why you do make less the second half of the year.
Yeah. Oh, we have 2,500 people watching right now.
Goodness.
This is fun. All right, so we're going to go to another question. Melissa writes in, nobody on my side of the family nursed. All my nieces and nephews were formula fed. I do have a sister-in-law who breastfeeds, so I could possibly go to her for advice, but what are some tips to make sure I'm successful? I'm very shy, so I'm worried about nursing in public. Is it okay to supplement with bottles, or will this lead to nipple confusion? When would be the best time to introduce a bottle? Thanks.
Such a good question, and I can totally appreciate where she's coming from. You know, a lot of women are shy to nurse in public, and you know, if you are happy and you feel comfortable, and I recommend that you get used to doing it, because the more you do it, and the more you do it, and other people see you doing it, the more moms will feel more comfortable, and we should be able to nurse anywhere. And some people don't want to, and that's totally fine as well. So bringing some pump milk if you go out and you don't feel comfortable nursing, totally okay. The thing that you want to keep in mind when introducing the bottle, a lot of times it will be recommended to wait a really long time, like 4 to 6 weeks. You'll hear this all the time, like wait 4 to 6 weeks before you introduce your baby to a bottle. And that typically can lead to the baby rejecting the bottle, where the baby never takes the bottle. Somewhere earlier, you know, at the like 2 to 3 week mark, did I say that right?
Yeah.
2 to 3 okay, I think I said it right. I heard it come out of my mouth. But, is a better time to make sure the baby's taking the bottle. I really introduce it even earlier than that in a very special way in my program, where you're doing very small amounts and you're doing it on a daily basis, so the baby stays comfortable taking the bottle and also taking the breast.
I mean, because a lot of women always write on my wall, they're like, "What's the best bottle for this? What's the best bottle for a breastfed baby?" Because a lot of moms go back to work. You know, bottles are not the devil; they're a necessary tool.
Definitely,
and it's like,
especially for working moms. I mean, and I always think, even if you're not working, unless your plan is to never do anything but feed the baby at the breast, which is totally fine. Most moms I meet want to at least have that option, and I think it's good for the baby to have that option, just because you never know where you
never
be
know.
separated,
you
and
never
your
know
baby
what's
will
going to happen.
You can feed the baby.
Yeah. All right. Andrea writes in, can your body not respond to a type of pump but work with another? My son was born at 34 weeks and now is 6 weeks old, and I cannot produce more than 4 ounces combined a session. I drink plenty of water, take supplements, and eat a healthy diet. Also, when I do try to get him to latch, he cries and gets angry, even if I have a fast letdown or not. The LCs I have seen have told me that my only option is to pump, and that is that. I was hoping for a little more encouragement than that. We're going to give you more encouragement right now.
4 ounces at a session is a perfectly normal amount. I don't really understand why anybody would think that you're not making enough, and I hope an LC didn't tell you that. But if you're feeding your baby and you're getting 4 ounces when you pump and you're at work, that's a full feeding. I think what happens is it's the perception of how much your baby's eating, like we were talking before. It's a misconception of what the baby actually needs to eat. And you are making enough. You're not going to make more than that, or you're just going to be creating an oversupply. I don't care how much oatmeal or brewer's yeast you take or fenugreek, you're just not going to produce more milk because you don't need it. Was there more to that question?
That was it. She's just talking about when she tries to get her son to latch, he cries and gets angry, even if she has a fast letdown or not.
Lots of times babies will get fussy when you're first latching them to the breast, and it could happen with a fast letdown because the baby could be gulping, and this is a really good question actually. If you're feeding your baby and the baby's gagging and choking at the beginning of the feeding, the milk's letting down, you may need to stop the feeding very shortly into it, like a minute or two, and burp the baby. Think about when you're drinking like soda or beer or whatever you're drinking, and you gulp really hard and it hurts and you're swallowing that air. That's basically what the baby's doing. And the baby needs to come off and burp because they're going to start to cry, they're swallowing or when they're crying. So crying at the beginning of the feeding could mean the baby needs to burp first.
Okay. This is good. Lauren says she has a pump from 2011 that she used with her first baby. She plans to use it with her second, due in December. Which parts, if any, should I replace? Is it safe to reuse all my old plastic bottles? I know plastic tends to break down over time.
Yeah. I would say that depending on the pump, and I think this pump is an open system pump that she's going to use again. The difference between open and closed systems, with an open system, I surely would not use the same pump from 2011. No, because, regardless of what we even think about the open system pumps, when they're old like that, there's milk that could have gotten inside that pump. There could be molds growing inside the pump.
Yeah.
I would recommend not using it. If it's a closed system pump, then what you want to do is replace the plastics, which she's asking.
Yeah.
I would say that getting all new equipment, like the new tubing, new flanges, new bottles, because they are plastic, you want to replace all that. And I want to go back to that question before, because I forgot to answer whether one pump could be good for a mom.
Oh, sure.
And so the question was, can one pump work for somebody and another pump not? And that absolutely is the case for a lot of mothers. It has a lot to do with the flange sizing. So if the flange is not fitting, or a pump comes and it doesn't have different flanges, you won't know. Also, how that pump, the controls on it, if it doesn't have enough speed and suction adjustments, it may not help you to let down.
Yeah.
So yeah, one pump could work for you and another might not. It might not have the suction levels to do that.
I mean, pumps are like car seats. They're not all created
They're not
equal.
the same.
What is the difference? Let's just do this one real quick, since we just talked about it. What is the difference between open and closed system?
Okay, so there are every pump is either open or closed, and I just happen to have a pump right here.
I just happen to have a glass of Malbec.
He's got the wine and I've got the pump. And so the difference between an open and a closed system is this. So this is the piece that goes up against your breast, right? And then air is sucking from the pump through the tubing here. Milk is going down into the bottle. With an open system, there is no barrier between the milk going down and the tubing. And so what can happen, okay, is as you're pumping, milk can splash and can even suck all the way into this tubing and back into your pump. And it's like impossible to clean this little tube. It's really hard to do. So that's an open system. With a closed system, and this is the Evenflo Advanced Double that we are giving away later, right?
One of you's winning that.
Yes.
Not this one, but a new one.
You'll get a new one. This one is a closed system, and I don't know if you can see this in my hand. This is a little, what they call diaphragm that goes in here, okay? And then the tubing clicks on. What that does is it creates a barrier so that as milk is going down, it cannot splash into the tube. And so you never get your tube dirty, you never get your pump dirty. When you go to clean it, you never wash any of those parts, you just wash this. And that's a closed system.
Yeah.
And the only kind of pump that I personally recommend as a lactation consultant and also as a mom, closed systems, only way to go.
Yeah, so that's the difference.
That's probably the first question I would ask when I look at a pump.
Yeah.
It's like the first thing you should ask yourself.
And
is it open
I
or is
did
it
not,
closed?
when I was working retail, back when I worked at Bye Bye Baby, none of us knew. None of us knew, because the only pumps they sold there were open systems.
Yeah.
So you just assume all pumps are the same.
Yeah.
And it actually wasn't until I really started working with her and chatting with her a whole lot, and the IBCLCs that I worked with at the Birth Education Center, that there were actual differences between closed and open systems, and the whole like, this pump is hospital grade, et cetera, et cetera. But hospital grade is not even recognized terminology by the FDA. It doesn't mean anything.
What hospital grade actually means is that it can be used, it's a rental pump.
Yeah.
It means that the pump itself can be used from one mom to another. It has nothing to do with the power on it. It has nothing to do with the ability to pump your milk, nothing.
No. All right, this is good. Casey writes in, Casey says, what are some tips for a mom transitioning back to work? How do I figure out how much milk my 3-month-old needs each feeding?
Well, Casey, it's really hard to tell because when your baby's eating at the breast, you can't see how much they're actually eating. And so what a rule of thumb is to just take it. Most 3-month-olds are going to eat somewhere around 3 to 4 ounces of milk. So what I would do is start by leaving that amount or feeding that amount in a bottle and see how much your baby finishes. One thing to do is to try out your baby with the bottle and watch the feeding. Once your baby starts to close their eyes during a feeding and they're just kind of moving their mouth and they're eating in their sleep, think about if the baby was at the breast at that point, they wouldn't be actually eating. They might be sucking. Right. It's just, it's non-nutritive sucking. So they're just sucking to suck. You know what I'm talking about.
Do y'all know how to, like, the suck to swallow? Do you know what to listen for?
Yeah.
I did not know any of this until I went through a lot of breastfeeding classes.
Yeah. When your baby's eating, you can hear the swallow, and what it sounds like, it's like, it's in the throat.
Yeah.
It's, and it'll sound different than a breath, which is like, it's, in the throat. And when they're swallowing, you know they're eating. And when your baby starts to fall asleep with the bottle in their mouth when you're feeding them, you take the bottle out and you look at how much they're actually eating. And remember, we were showing this before, it's really not a large amount. You want to leave small amounts and several feedings of it while you're gone, enough to feed every 2 to 3 hours, or if that's what your baby's eating. But that's really, you're going to have to do it by trial and error, really, because you can't watch the milk going in. Typically around 3 to 4 ounces.
This is good. When you take frozen milk, or Adra wrote, when you take frozen milk out of the freezer, can you put it in the fridge? For how long? If not, how do you make sure not to waste frozen milk? I just think this is a very good question for milk storage in general. So
yeah, absolutely. So milk can be frozen for 3 to 4 months in a regular freezer, and so, you know, but when you do take it out and defrost it, it has to be used within 24 hours. So 2 things about that. One is, you don't want to take out more than you're actually going to use for the baby, because you're going to waste it if you don't get to feed it. And the other thing is, think about that when you're putting it into the freezer to freeze. I would say freeze them in smaller quantities, or some like 4-ounce bags, some 2-ounce bags, some 1-ounce bags, so that the baby needs a little bit more. You're not defrosting a whole feeding. But yeah, that milk storage is a really, you know, important thing, because it's so different than formula. And typically people will confuse it. So like with formula, you know, once the bottle touches the baby's lips, all the milk is ruined, it needs to be thrown out. That's not the case with breast milk. You could put that back into the refrigerator, use it for the next feeding. Breast milk that's pumped and fresh can sit out for anywhere like around 8 hours at room temperature. Formula needs to be thrown away after an hour. And breast milk can actually be in the refrigerator up to a week and still be good. Breast milk is alive.
Yeah.
You know, it's living. It's got antibodies in it. It's cleaning itself. It's amazing. And it's totally different and needs to be treated that way. And it's important to make sure that your child care provider, whoever you're leaving your baby with while you're working, is really knowledgeable about breast milk storage and how to handle it so that they're not wasting your milk. It's too precious.
Yeah. You don't want to waste that. Okay, so I'm going to find some more questions. And
Are they having a good time? I'm talking
I
a lot.
think I'll okay. No, listen, we're here to talk. We're here to talk. Like, we can have fun and whatever. The 2 of us even thought about getting back on here, because Facebook Live, just to let you guys know, Facebook Live only lets you go for an hour at one time. So we thought, you know, this is about breastfeeding and pumping and whatever, but we thought maybe after we're done here, we would take like a 5-10 minute break, and then we would just get on and do a random Q&A with us, because she has an insane amount of knowledge in her head, and I just know about how to fold strollers. So
not just
truth, but to have access to her brain as a CNM and working with all, you know, pregnant women and moms who are postpartum, I think it would be really cool, since we're here in her living room. Why not make use of it, correct? So we're going to go to another question now. Let me find something. This is interesting. Can I start pumping at 19 months, or is it too late? I plan on nursing the 2 at least, but when I try to wean him from my boob, I want to have a stash. I still have a heavy letdown each time he nurses, which is an average of 8 times a day.
Yeah, you can absolutely pump. Your body's going to keep on making milk for as long as you breastfeed. That's the way it works. So if you're still having a good letdown and you're feeding 8 times a day and you want to pump up some extra milk, you can definitely do that. Your body may take, if you're not used to pumping at this point, this long into nursing, it may take a little bit of practice to get the pump used to your body versus your baby, since you're so used to your baby. But with a good pump where you can adjust the speed and suction controls, you can absolutely pump.
Very good.
Yeah. And it's a good idea to have a little extra there.
Shannon writes in, most effective ways to prevent clogs and mastitis.
Good question. So 2 of the best ways to prevent clogs and mastitis, one is to not overproduce, which means do not pump a lot of extra milk to what your baby's actually eating.
Yeah.
One of the most common reasons for mastitis is overproduction or engorgement. And moms get really excited when they can make that much milk, but that kind of oversupply can lead to a lot of problems,
So
breast infections.
why is oversupply detrimental?
Well, you know, your breast is so overly full with milk, and what that does, it puts a lot of pressure on the breast tissue. That's how you get plugged ducts. That's how you get breast infections, and breast infection can be a really serious thing.
A friend of mine recently had it, and she called it the boob flu.
It's like 104. You get like 104 fever, sick like the flu, can't move. I mean, it can be. You can get really, really sick, and a lot of moms have that recurring over and over again, and it comes from not knowing that they're just overproducing. You know, they're told sometimes by doctors, by nurses, to breastfeed and then pump the rest out. Which is not the way you're supposed to do this. Your body is supposed to be making what your baby eats. So when you breastfeed and then pump the rest out, you're feeding two babies. You're feeding your baby and you're feeding the pump. And your body has no way of knowing that it's not. So it's doing what it's supposed to do, but it's going to cause you problems. The second and most common reason that I see for plugged ducts and breast infections is actually wearing poorly fitting bras. So nursing bras are super important to be fit properly. Underwire bras are not a good idea, especially in the beginning when you're first breastfeeding. I highly recommend against underwire bras, underwire nursing bras, maybe later as your breast size goes down and they're not as full. But the reason is that even if they're fit properly, your breasts are changing size from feeding to feeding. So like they're bigger an hour earlier and then they're smaller after the feeding. So as they're getting full towards the time when you're going to feed, that wire's putting pressure on the milk ducts, on the breast tissue, and you can get plugged ducts and you can get infections from it.
Very, very interesting.
And there are a lot of really good nursing bras that are not underwire. If they're fit right, you wouldn't even be able to tell the difference.
There are a couple people on here. My sister has experience with this. But they are asking, what are some tips for breastfeeding twins? And I will tell you my experience with Jennifer. So my sister has twins that are 5 years old. When they were born, I went to Minneapolis and I stayed with them for about 6 months once they were out of the NICU. And because Jennifer needed sleep, I would sleep in the nursery a lot of the nights. The twins would wake up, I'd get them ready. Jennifer would come upstairs, she'd sit down, we'd get the twins latched on, I would go get Jennifer water, and we would sit and talk for 20, 30 minutes while she nursed. Now clearly not everybody has that kind of support system, but support with all breastfeeding, support is number one. So aside from that, in terms of breastfeeding twins, like...
Yeah, it's so, this summer, one of my best friends, they had twins, and I had the opportunity to go to Dallas for an entire week and sleep at their house from the day they came home from the hospital and be with her twins for a week. And it was such an amazing experience because I really got to see, I mean, having not had twins myself, to be there from the beginning to see what are some of the challenges that moms have when there's two instead of one. And I guess starting from the beginning, one of the things that I would recommend to a lot of moms is to nurse them separately, at least at first. Sometimes trying to latch both babies perfectly in the beginning when they're small, when you're still not skilled with it, it could actually take longer and have more difficulty where you're not latching perfectly onto the breast, and that can cause nipple pain and you can't hear who's swallowing. It's hard to keep track. So nursing them separately in the beginning could be really helpful. And also I think having a good big pillow, because you need the extra support because you're trying to manage two babies.
You're like double footballing.
Double footballing. And so, you know, having one of those giant, you know, if you're asking, do I really need one of those giant pillows? I think that especially for newborns, it's going to make a difference because, you know, even securing the baby on one side, you'd have your hands free. So yeah, and then do it on the bed so that.
Yeah, Jennifer found like they did the double My Breast Friend pillow.
Yeah,
it's a great pillow, but it's massive and it wouldn't fit in the chair with her.
Yeah, on the
so
bed.
When she was nursing in the chair, we just use like regular pillows. Other than that, you know, you lean up against the couch. If you sit on the floor and lean against the couch and do that with the pillow, it's awesome. Because I nurse babies.
Great. How did this happen?
What's going on with my body?
I'm choking up or something.
Yeah. So, yeah. So, yay. Let's go to another question. Somebody says we're fighting for their attention for the World Series. Yay. Let's see here. Is there a good rule of thumb for how much milk is enough for an emergency stash? I'm due with baby 2 in March and plan to exclusively breastfeed, and I won't be returning to work, but figure I should pump for an emergency stash, but I don't want any to go to waste either.
Everyone should have an emergency stash, and this is super important because you want to make sure.
Please. It's also important that Joe's putting more wood on the fire.
Put more wood on the fire. So typically, I mean, you'll have people who say that they've stored up, you know, a freezer filled with milk. They went and bought an extra freezer just so they can put all their frozen milk in. This is not necessary, and if you're not able to do that and you're listening to someone who is, you could feel really like insecure, like I'm not making enough or somehow I didn't freeze enough. Mainly what you need is like maybe 10 to 12 extra feedings. So we're talking about maybe 3 to 4 ounce feedings, 10 of them, 30 to 40 ounces away in the freezer as like an emergency supply. If you're going back to work, it still is the same amount because you're not going to be using that while you're working. You're going to be using that as your emergency, and then you're going to be pumping while you're at work to maintain your supply and using your fresh milk for the next day when you get home. So I just came out with my new program, Breast Pumps and Briefcases this summer, and there's a whole chapter on how to store up enough milk, how to calculate how much you're going to need for that first day back, and you want to start that early.
Yeah, that was what, like 2 months ago when we did that on our Facebook chat, and the response was crazy.
Yeah, with the calculation.
Because there's no like real education for a pumping mom or moms in general, to be honest.
Yeah.
What you need to do when you're going back to work.
And it's really not that complicated if you start to break it down. So like, for example, if you know you're going to need, 30 ounces for your freezer stash, that's like 10 feedings, and you're going to need a certain amount of ounces for your first day back. You kind of divide those ounces over 4 weeks of time, and I need to pump 2 ounces every day for 4 weeks, and I'll have everything I need for my freezer stash and for my first day back, and that will get you started. You obviously don't want to wait till the day before you go back to think about this, just to make it a lot harder. But if you do, you just pump for your first day.
This is a question we already answered on Facebook, but I think it's actually totally valid and we should address it here. Andrea writes in, recently discovered my little one is sensitive to dairy and eggs. Do I need to ditch the pumped milk I had prior to discovering my allergy? You don't necessarily have to dump it. You can donate the milk. But if you don't have a place to donate, you got to get rid of it.
You don't want to use it. And that's the thing, your milk is free and it's abundant and there's always more. And obviously you're not, even though it's hard to watch and pour that milk down when you've worked so hard to pump it, if the baby has a clear sensitivity or allergy, you obviously don't want to use it.
Okay. So we did a pretty good job going through some of these. We have a little bit of time now to just go to live questions. So I'm going to log on to this video real quick, and hopefully there's no feedback. I plugged in my headphones, but you never know.
This is so cool.
Let's do this. Not responding well to my manual pump anymore, and I have limited time to pump between classes. Strong work for trying to pump in between classes. Oh my gosh, that just disappeared. Are there safe supplements recommended to maintain good supply so I still make enough while away from him?
With a manual pump?
With a manual.
That could be the issue, is that, some people can use a manual or occasionally use pump when they're away from their baby, but on a regular basis, I would say that it'd be better to have a stronger, more effective pump, like a double electric pump, if you're going to be away more often. I think that, using those occasional pumps can work if you're using it for like one feeding, but if it's not working and you're not getting your milk out, you don't want to risk losing your milk. Make sure that your pump is working well, and it could be the pump that's doing it.
Awesome.
And the supplements, Before going to supplements, I would switch pumps.
Yeah, and find a good IBCLC to help you with everything.
Exactly.
Because there are supplements out there like More Milk Plus. There's tea that Earth Mama Angel makes. There's like the Milk Boosters cookies that we work with. My sister used those cookies and saw an increase in her supply, but then oversupply has problems. Here's a question. Tips for getting rid of thrush that isn't responding to antibiotics. I'm trying to help my dear sweet friend that's been battling for 4 months now.
Well, the first question I have is, why are they using antibiotics for thrush? Because antibiotics actually causes thrush. Thrush is a yeast infection. It's a fungal infection. It's not a bacterial infection. So that'd be probably the first thing. If the doctor's treating that mom or the baby with antibiotics, it could actually be making things worse. I would make sure that the baby's, first of all, depends on whether you have that on your nipples or if it's just in the baby's mouth, but make sure that they're getting the proper treatment, which would be more of an antifungal medication, sometimes topical for the nipple, sometimes diflucan, like an oral dose of diflucan for the baby or for the mom for for like a yeast breast infection, a yeast infection on the breast. But antibiotics? No.
I'm not a doctor. I don't know about things like this.
Not antibiotics. That could be the problem.
Just like my sister and brother-in-law used to give me shit for.
That could be the problem.
They asked me a question once, and I said, I'm not a doctor. I'm a baby gear expert. Christine asks, my son just turned 1 year old, and he's starting to bite my nipple, but just on one side, my more productive side. Can you suggest a way to get him to stop? It's so painful.
It's tough when they're biting. I think that one of the ways to do that is to take the baby off, especially a 1 year old, where they can really understand it. It's harder when they're younger, and they don't really get it. But when they're at that age, taking the baby off the breast once they start to bite, putting the breast away at that point, and just saying, no to the baby will start to understand that they're not supposed to bite. And it could be that the baby's teething too, so substituting with something that they can chew on, it's either a teething ring or something that they can bite down on. Have that ready and available to give to the baby instead of your nipple.
Okay, real quick. I have a 3 and a 5 year old who've never witnessed a baby being breastfed. Any tips or videos or anything to prepare for their sibling due in April so they aren't shocked about what mom's breasts are for, feeding the baby?
I think that's so sad if you think about our society. You have all these images, and it's always a bottle in a baby's mouth, and so it is true that a lot of young children will never see, and even adults will never see someone breastfeed. But there are some really good books that they've made, and I can't even think of the name of. There's a couple of really good children's books that are about breastfeeding that you can introduce your children to. I wish I could remember the name of it.
I don't know.
I'll get back to you.
Okay.
I have one. But it actually introduces breastfeeding to a child and normalizes it so that it's not so odd of what they're doing. I'll tell you, when I was, I have 2 daughters. One is 13, one is 11. And I was really concerned when I had my second baby that Jade, my oldest, she was 2.5 at the time, would be really jealous because I was spending time with the baby, and obviously needed to because I was breastfeeding her. So what I did was I actually turned our breastfeeding sessions into story time, and so I would position the baby really well, and I used a breastfeeding pillow, and I would read to my older daughter, and that was our time to read, so I could spend time with both of them, and she would be like, feed the baby, mommy, feed the baby. I mean, she would look forward to the time when we could feed because she was part of the experience. So she would sit with me, we would feed the baby, and we would read together.
I would bite my sister's head while she nursed on my mom when we were little.
The jealousy.
Thank God Jennifer and I get along now, but I used to bite her. I used to dump powder in her face. I used to be a rotten brother.
You've made up for it.
I've made up for it.
You've made up for it.
So this is the question is gone now because of the stream. But any tips for nursing a baby with lip and tongue tie until the revisions happen?
I think
lip and tongue tie is not addressed enough at all.
Yeah. You know, depending on how severe, it can be really difficult, and so you want to address this really soon. You know, the best thing is to make sure the baby's held close to the breast. You want, you know, the problem with the tongue tie is that the tongue is not going to be able to extend outside the baby's mouth very far, and so the nipple's going to be, they're not going to be able to get enough of the nipple far back into their mouth where it actually compresses and gets the milk to flow. So holding the baby really close to you, but taking care of it as soon as possible is really the answer.
Okay.
It can cause damage to your nipples and can really interfere with the milk transferring to the baby, so the baby's not gaining weight and not emptying the breast. And then, of course, if you wait too long, it could also interfere with your milk supply too. So.
Somebody asked earlier, we kind of covered, you know, going back to work and like a stash, but when you're going back to work, how early before you go back to work should you start pumping for your stash?
Oh, yeah. Well, that's what we were saying earlier, is that the sooner, the better. You want to do that calculation like I do in the program, right? Where you start calculating how many ounces do I need total, and that's all your freezer stash. So, you know, anywhere from 10 to 12 3 to 4 ounce feedings, right? So each feeding's somewhere between about 3 and 4 ounces, and you're doing 10 or 12 of these. That's your freezer stash plus your first day back. So say you're going to be gone from your baby for, you know, 9 hours, and you're going to supplement 3 feedings in that 9-hour time. That's another 3 to 4 ounces per feeding, 9 to 12 ounces for your first day back. A lot of numbers.
Yeah.
This is why you have to write it down.
Math is hard.
You have to calculate this. You need to write it down. So it's 10 to 12 feedings in the freezer, 3 feedings for your first day back. Calculate that all out and try to spread it over the longest period of time. I would say around, you know, starting at 6 weeks to start pumping every day a little bit is your best bet. But if you're going back to work at 6 weeks, you're going to have to start earlier than that.
Yeah. Okay. Here's some interesting stuff. This is quick. Just got the opportunity to join. I'm allergic to lanolin. Any suggestions for other products I can use? Yes.
Yes.
Mother Love,
Everything.
Earth Mama Angel Baby, your own breast milk.
I do not like lanolin at all.
Not needed. Not needed. It comes from wool. You don't know where that's been. Not that your infant is necessarily vegan. But, you know, you have to be careful with that stuff. So
I don't recommend lanolin for anybody. It's something that doesn't really do much. It's very sticky and thick. I've never seen it really heal sore nipples. Like Jamie mentioned, I think anything with calendula and the Earth Mama nipple butter is my favorite. That's the kind that I would recommend. And just pure breast milk on the nipple is going to be way better than lanolin. Stay away from the lanolin. It's what they give out in the hospital.
Yeah.
But it's just, I never worked for me.
Here's a really good question. How would one re-lactate? We took my baby off breast milk because he had a milk protein allergy. We are now finding out that it's most likely acid reflux that is the problem. So I would like to re-lactate if at all possible. I'm 5 months postpartum, 2 months dried up.
Well,
with a happy face emoji.
Oh, good. Happy face. You know, it's very possible to re-lactate. In fact, but the sooner you start back, the better. Like the longer time has gone by, the harder it's going to be to get your milk back. If you're still producing a little bit, the best way is to start pumping to get the baby, or to get the baby to latch if the baby will latch. That's going to be the best. But starting by stimulating your milk supply by pumping or extracting milk from the breast, it's the #1 way to get that milk going again. You're probably going to need some supplements, whether it's fenugreek, like More Milk Plus, or you know, the teas and the supplements may be enough. It may not be enough, and then after that, there is medication that you can take. You need to talk to a lactation consultant. But it is possible. I mean, we have adopted mothers who lactate.
Oh yeah, I've worked with adoptive moms who have induced lactation using like they use an SNS and they use all this stuff to kind of trigger it.
Men can make milk.
It's fascinating. It's fascinating.
Yes.
Mm-hmm.
Joe found the picture of the book that I was looking for before. It's called Best Milk. Yeah, it's a children's book.
And people are putting links up on here, which is great. That's the thing I love about this. Like, I love
You're helping
Periscope.
us.
Facebook is like, this is communal. You know, it's like you can put links down here because I clearly can't be on my computer all the time while I'm doing this. So we all help each other. It's the global village, if you will.
That's the best.
It's the best. Here we go. A few weeks ago, I began pumping for my stash and for bottle feeding. I built up from 6 ounces a day to 36 ounces. Lately I've been dropping and now I'm down to 28 ounces a day. It's enough for now, but I'm afraid it won't be enough for when she gets older. Will I naturally start producing more later, or do I have to do something to produce more again?
6 ounces a day to 36 ounces a day, is that what she said?
Yeah.
She built up from 6 ounces a day and now she's making 28 ounces a day?
Yeah.
It all depends on how much she's feeding the baby as well. Is she exclusively pumping? I couldn't hear that.
There's no.
Doesn't say.
Yeah.
Again, this could just be a perception issue of what she thinks, what you think the baby actually needs to eat, when that could possibly be plenty and just the right amount if she's just pumping to supplement her breastfeedings.
What time is it? I just want to make sure we don't run into time problems.
9:48.
What time?
9:48.
Can you give me a 2-minute warning? At 2 till, at like 9:58?
Sure.
Thank you.
33.
Thanks, Joe.
33
All right. So I don't know how to pronounce this. It's Lipase.
Lipase.
Lipase. The more you know. People are asking about high lipase, how to deal with that. I don't even know what that is.
Okay.
So take it away.
So there can be, some moms have a higher lipase. It's an enzyme that's in the milk. And what that does is it can cause an issue when you're trying to store and freeze your milk. Typically this is not an issue at all when you're feeding directly from the breast, so fresh breast milk, no issue. Then you pump it, you freeze it, and when you go to take it out of the freezer and defrost it, it has like a rotten smell to it. It smells
Is that
sour.
why some of them were like, when I thaw my milk, it smells like formula,
yes,
etc.?
It's
Okay.
like smells
Got it.
spoiled. And it can taste soapy, or it can smell soapy or spoiled. And it's actually not spoiled. It's not bad for the baby, but some babies don't like the taste of it. So what you can do if you are one of those moms who just has naturally high lipase in your milk, right before you're about to freeze it, you want to scald the milk. You actually take your fresh pump milk and you take it, you put it into like a pan, and you scald it really hot till you see the edges start to bubble, and then you freeze it from there.
Okay.
Scalding it right before freezing will eliminate that issue.
Really?
And then the milk won't taste like that afterwards.
Look at that. We're learning so much about a fire
I mean,
tonight.
think about it. Breast milk, although it can be frozen, it was never intended to be. It was never intended to be pumped and used for later. So this is sort of like a byproduct of our society of pumping and
This
freezing.
is a great question, and I want to get this. I want to read all of it before it's gone.
Yeah.
I am a type 1 diabetic breastfeeding my 3-month-old. Do you have any info on how many calories you actually burn while feeding? I'm running into low blood sugars after I feed. Sometimes I'm able to snack before to avoid this, but sometimes I'm not able to.
You know, for most people, this is not going to be an issue to know exactly how many calories. For this mom who's diabetic, yeah, it is important for you to know. Typically, what we say is that about 500 calories per day in a 24-hour period is what you're burning. If you want to divide that, again, it's not going to be a perfect calculation, and so you're going to be testing your blood sugars more frequently to make sure you're maintaining that. But somewhere about 500 calories a day is what you're burning when you're breastfeeding one single baby, which, you know, divides out to, I don't know exactly how many per feeding. Depends on how many feedings you're doing.
If baby only nurses on one side and the other feels very full, is it okay to pump the other side?
If the baby nurses on one side and the breast feels full?
The other breast feels full.
You can. It's actually a good time to pump some extra milk, but if you start making that a habit with every single feeding, you're going to run into that issue that we were talking about earlier, which is an oversupply. Now, again, your body's making extra milk and doing exactly what you're asking of it, feed two. It's got twins, right? It's got the pump and the baby, and so it's going to keep on making that extra milk. I would say that if you can do that once, usually like during the night, that's when your breasts are really full, or first thing in the morning, that's okay to pump one extra bottle, but don't do a ton of that because you're just going to create an oversupply. but it is okay to pump the other side. It's actually a good time to pump. If you can feed your baby, like first thing in the morning, feed your baby on one side, put the pump on the other side. It's typically a time when you have extra, and actually feeding the baby is going to stimulate a letdown so easily that it usually helps to pump. That was a good time for me.
Any tips on how to increase milk before baby comes?
No. There's nothing you need to do before the baby comes to do anything with your milk supply. The one thing that you do need to do before your baby comes is educate yourself, okay? This is the time to take your breastfeeding class, to read the books, to consult with a lactation consultant, to have somebody on hand, to talk to your friends who are successful with breastfeeding. That's the preparation that needs to be done during pregnancy and before your baby comes, not winging it once the baby's in your arms and you're trying to figure it all out. It could be really hard at that point, but there's nothing physically that you need to do. I hear this all the time, like, do I need to toughen up my nipples?
Yeah.
Do I need to prepare my breasts?
Just slap them alive.
I know, no, don't do that. You don't need to do any of that. It's not going to do anything except make you sore. It's not going to prepare you for breastfeeding anyway. And you definitely don't need to do anything to prepare your milk supply. Your milk will come in. It's a hormone shift that happens. So, you know, when your baby is born and your placenta delivers, it actually causes a hormonal shift in your body, and your milk will come in 2 to 3 days later. It's just the way it is. So, that's going to happen regardless of whether you're prepared or not. And that's why people who are not breastfeeding or formula feeding from birth still get their milk. Okay, because it has nothing to really do with breastfeeding. It's a hormone shift.
Here's a question. I'm actually kind of shocked. Thank you for the warning, by the way, everyone.
Are we about to shut off?
We have 5 minutes.
Okay.
So a painful letdown, is that a sign of any kind of issue?
Typically not. Typically it's it can be painful when everybody experiences letdown differently. Some people feel tingling. Some people
I get let down all the time.
You probably do. Some people experience like a tingling sensation. Some people experience it like a painful sensation. And other people will have, you know, what's happening when your milk lets down is the stimulation to your nipple from the baby sucking is actually causing a release of oxytocin in your brain to cause the milk to excrete, you know, or let down or come out. And that hormone can cause you to have sensations all over your body. When I was breastfeeding, when my milk would let down, I would know because I would get like dizzy for a second.
Right.
Like I'd have this like feeling like I'm gonna like fall over, and then I knew my milk would let down.
That's interesting.
Yeah, so everybody experiences it differently, and it can be a little bit painful for some.
Okay, we've got about 3.5 minutes. That's really interesting. Let me see here. Any tips on how to breastfeed with IGT? Me and my baby have been nursing for almost 9 months, but I feel like I don't make anywhere near what I need for her to thrive. I feel like my supply is dwindling yet, and I do not respond to my pump.
IGT is insufficient glandular tissue, and so some moms just don't have enough breast tissue to make enough milk, and this is a very real thing. Make sure that if this is the case, that you're being diagnosed by a qualified lactation consultant who can tell you that that really is the issue. And what I would say is that even if you can't make all the milk that your baby needs, whatever you're making is still perfect and great, and so it's still worth it. So it's not an all or nothing. I mean, I think that's, if I could have one big message to all moms, breastfeeding is not an all or nothing thing.
Nope.
Okay, so whether if you're gonna supplement or you're gonna exclusively breastfeed or not, it doesn't matter. Or if you can only do it for a few weeks, it's still worth it.
Better than nothing.
Any milk,
you know,
has benefit to it. And I have moms who just say, you know, I don't really want to breastfeed. I'll say, well, you can just do colostrum in the hospital. And that too will be wonderful. So
there was an IBCLC that I worked with at the Birth Education Center, and at the end of her class, she was like, as the pledge at the end of this, try to nurse the first day. If that is successful, try to nurse day 2. Try to nurse day 3. It's just kind of like this little pact you make with yourself, because at the end of the day, the goal is to get the baby fed. That's it.
Definitely.
So if you're doing exclusively breastfeeding, if you're supplementing, if you're using all formula, it's baby's eating.
Exactly.
Baby's living life. That's the goal.
And anything you can do is better than nothing. And if you did some, be proud of yourself.
Yeah.
I think we're at the end.
Yeah, we have a minute and a half now.
That went fast.
So that was so quick.
Too fast.
So we are done with this portion right now. I will go through here.
Part one.
We're done with part one. I will go through and pick a winner of the Evenflo pump. Thank you all for hanging out for our first time to experience this together with the two of us.
So great.
It's old school here. This has been great. So we are going to Nathan, go to bed. All the moms told me to put their kids to bed.
So great.
Nathan, go to bed. Your mom's tired. So we are going to log off of here in a second. We're going to take a little break. Then we'll come back. Okay? You can ask anything you want. You can ask us about products. You can ask her about pregnancy things, delivery things, outfit advice, how to build a fire. Joe can talk to you about that.
Joe can tell you all about that.
So thank y'all so much for this. Thank you, Evenflo. Thank you, Sherry, for having me over tonight.
Awesome.
This was great.
So great. See you soon.
Yeah, we'll see y'all later. Bye.
Bye.
Hunter, go to sleep.